Hepatitis. Hepatitis means inflammation of the liver. The liver is a vital organ that processes nutrients, filters the blood, and fights infections. When the liver is inflamed or damaged, its function can be affected. Types of hepatitis. 1. Hepatitis A have can spread due to contaminated food and water or close physical contact. 2. Hepatitis B HBV is transmitted through contact with direct body fluids or contact. 3. Hepatitis C HCV is contracted when contaminated blood enters the bloodstream of an uninfected person. 4. Hepatitis D HDC can only be obtained when a person already has hepatitis B. Hospitals. 5. Hepatitis HEC spreads through contaminated food or water and is commonly experienced by frequent travelers. Symptoms of hepatitis A, B, and C can include nausea, fatigue, mild fever, yellow skin or eyes, stomach pain, dark urine. Symptoms of hepatitis D: increased bilirubin in the blood, intoxication, jaundice, fever, cirrhosis, violation of protein, translation in the liver, simultaneous enlargement of the spleen and liver, physical weakness. Symptoms of hepatitis E: nausea, vomiting, yellowing of the skin and eyes, pain in the right, hypochondrium, intoxication, reduced appetite, severe weakness, malaise, dark urine, bleached feces, raise body temperature to 38 C. Several different viruses cause hepatitis, including hepatitis A, B, C, D, and E. The hepatitis A and E viruses typically cause acute infections. The hepatitis B, C, and D viruses can cause acute and chronic infections. Causes: viral hepatitis is caused by infection with a virus. In developed countries, hepatitis A, B, and C viruses cause about 90% of acute hepatitis cases. Hepatitis D and E viruses are also responsible for hepatitis. Non-viral hepatitis is mainly caused by the ingestion of products toxic to the liver, alcohol, drugs, toxic chemicals, etc. They can also be the result of diseases affecting the liver, such as fatty liver, NASH, or fatty liver. Transmission: hepatitis is transmitted differently according to the virus involved. By accidental ingestion of feces for hepatitis A, bodily secretions such as saliva, sexual secretions, or by blood contamination for another hepatitis. How hepatitis is treated. Treatment options will vary by the type of hepatitis you have and whether the infection is acute or chronic. Hepatitis A. Hepatitis A is a short-term illness and may not require treatment. However, if symptoms cause a great deal of discomfort, bed rest may be necessary. In addition, if you experience vomiting or diarrhea, your doctor may recommend a dietary program to maintain your hydration and nutrition. Hepatitis B. There is no specific treatment program for acute hepatitis B. However, if you have chronic hepatitis B, you will require trusted source antiviral medications. This form of treatment can be costly, as you may have to continue it for several months or years. Hepatitis C. Antiviral medications can treat both acute and chronic forms of hepatitis C. Typically, people who develop chronic hepatitis C will use a combination of antiviral drug therapies. They may also need further testing to determine the best form of treatment. Hepatitis D. The WHO trusted source lists pegylated interferon alpha as a treatment for hepatitis D. However, this medication can have severe side effects. As a result, it's not recommended for people with cirrhosis, liver damage, those with psychiatric conditions, and people with autoimmune diseases. Hepatitis E. Currently, no specific medical therapies are available. Trusted source to treat hepatitis E. Because the infection is often acute, it typically resolves on its own. Doctors will typically advise people with this infection to get adequate rest, drink plenty of fluids, get enough nutrients, and avoid alcohol. However, pregnant women who develop this infection require close monitoring and care.